everyone. Thank you so much for joining us today. Good afternoon. I was going to say good morning, but good afternoon and happy Friday. My name is Molly Mcguirk. I am the Events and Programs Manager for Travelers Connect. We do host these forums for you. So this is an opportunity for you to ask any questions that you might have, any concerns. If you have input of your own that you would like to include, please do. This is for you, and we want to hear from you. How you're able to ask those questions is there is a Q&A button located at the bottom of your screen. So if you want to go ahead and click that, you can do it anonymously if you don't want us to see your name, or you don't have to. Either way, I don't read the names when I'm asking the questions, so it will be, your privacy will be protected. I also just want to note that we will be recording this as well, and it will be available 24 hours on the Travelers Connect website and the Travelers Connect YouTube page. So on that note, I would now like to turn it over to Brenda McClellan. Brenda, thanks for being here with us today.
Thank you, Molly. And hello, everyone. I'm Brenda McClellan and the Director of Investor Engagement with Travelers Connect. I have the pleasure of introducing Carl Alden today. Carl is the Government Relations and Insurance Director of the Michigan Association of Chiropractors, and he oversees the development and implementation of government relations initiatives, fundraising, and grassroots efforts. Carl works directly with the Government Relations Committee, Insurance Relations Committee, and outside consultants. Carl, thank you so much for joining us today. I'll let you go ahead and take it from here.
Thank you very much. It's a pleasure to be here, and I appreciate you putting this on. I think it shows the value of associations and organizations like yourself, that you can deliver some value to your membership. Before we get rolling on what you asked me to talk about, I'd like to make those on the call today aware of something called Cairo Cares. It is a program of giving back from the chiropractic community to the society at large, the communities that we're a part of. And so on May 19th, which is next Tuesday, there's a large nationwide drive. Here in Michigan, we are focusing on food banks, local food banks, asking chiropractors, their patients, their staff to make a donation. There's a great need for our local food banks now. And it'll be done through Feed America. You can actually go on to our website, which is chiromi.com, and find a link and make a donation if that's something that you can do. So we appreciate that. So I was invited to talk about what's happening in healthcare. I understand it is mostly chiropractic offices and physical therapist offices on this call in terms of what's happening under our stay-at-home orders, because we still are under a stay-at-home order. There's been a series of them. I believe we're under Executive Order 2020-70. And I would expect that to go on for a while. The governor has repeatedly said her most overriding concern is saving lives. And I would expect, though it may be modified, that we'll see that it gets extended. So what does that mean? Well, it means as a healthcare provider that you're able to treat patients for the purpose to sustain and protect life. Definitely not business as usual. Very often you are treating patients to prevent deterioration of conditions, treating them to promote general health. Those become hard to justify under the heading of sustain and protect life, but there definitely is a role to pay for both physical therapist offices and chiropractic offices in sustaining and protecting that life. Dr. Khaldun, the medical director for the Michigan Department of Health and Human Services, has made it clear that sustain and protect life is a clinical judgment. It's something that a chiropractor, as a chiropractic physician, can do diagnosis and determine whether this is something that I need. Am I keeping a patient out of going into an emergency room or urgent care? Am I preventing deterioration of a acute condition? Am I keeping people off of more adverse courses of treatment, including opiates? PTs don't have the same degree of diagnostic capability or direct access, so a lot of that determination may be made for you coming through MDs and DOs. Whether you have been seeing patients continually through this crisis that we're in, or whether you're looking at starting now, because without a doubt, when you're talking about the physical medicines, things that could have been put off 8 weeks ago have become extremely acute now, and patient needs to be seen. There's some things that you need to do in your office. Number one, under the governor's executive orders, you need to have a COVID-19 preparedness and response plan. And executive orders have the force of law, so it's not something that is a recommendation. It is something that you need to have. Now, she has based that upon the guidance and preparing workplaces from COVID-19. I know this doesn't show up very well, and I apologize, but this is from OSHA, and you can print this off of OSHA website. It's a good guide. It's a general guide for businesses, so you're going to want to make it specific to your particular situation in your healthcare clinic. For chiropractors, we have created a template based on this that you can go out to our website and pull off, and it's in a Word document, so you can tailor it for the needs that you want. But basically, you're going to need to take a look at how are you going to protect your patients, your staff that are working for you now, and yourself. You want to keep in mind that I know for chiropractic offices, usually it's 1 or 2 doctors in the office. If the doctor is sick, the office is closed. So it's very important that you protect yourself also. And you want to take a look at what OSHA would call engineering barriers, safe work, which I call procedural barriers, and administrative, and PPP. Those 4 areas to see how you can minimize risks. They also have a pyramid of risk in an occupation. And I think for most PT offices and chiropractic, you would naturally fall in a medium risk. You want to, if possible, through your procedures, lower it down to low risk, because sooner or later you will have a patient that gives you a call that says, I was in 2 days ago, I've just tested positive for the virus, and the public health department will probably be following up on that, and you want to be in a situation where you don't have to shut your offices. Everybody doesn't have to go into a 14-day quarantine. You want to be able to be in a situation that because of your engineering procedures, your administrative procedures, your actual standard operating procedures, and the type of PPE that you're using, you can defend staying open and only having to self-monitor. So engineering procedures are things like if you can create barriers between staff that are not treating patients. When you're talking about physical medicines, if a chiropractor is doing an adjustment, that's hands-on. Oftentimes PTs, if you're working with patients, it's going to be hands-on. You're going to be in close contact. There's no way to get away from that. But other staff, you know, the reception area where first patient meets somebody in an office, if it's possible to put up physical barriers, to, if that's not possible, do taping of floor so that people are stopped with proper social distancing. Signage, removal of chairs, and normally in a waiting room there's magazines and maybe toys for kids, that kind of thing. Get those out of there. I know a lot of chiropractic offices now are using their parking lot as a waiting area. So a patient comes in, they send a text message or call the office, I'm here, and they wait in their car until they're called into the office so that patients are not encountering each other. Procedural, by that we mean things like following the OSHA guidelines, the CDC guidelines, EPA sanitation guidelines, triaging patients before they even walk into your office. So a patient, before they're able to walk into the door, should be answering some questions about, have you been exposed? Do you have certain symptoms? If they do, don't even let them in your office. Make a proper referral out to somebody to do testing, to check out whether or not they do have the virus. Administrative, reduce staffing, potentially work from home for some staffing. For example, in a healthcare clinic, there's usually somebody doing the billing. Is that something that they can do from home? So they can stay, they can be a important person on the staff doing important tasks. You still need to keep cash flow going, but they can do it from home so that they're not having patient encounters. Or can you isolate them in your office? Can they be in a room away from treatment areas? So again, they're being isolated. Can you do shifts so that staff are socially isolated from themselves, where somebody is coming in earlier in the day and somebody's coming in later in the day? Providing training on all these procedures becomes very, very important. And then we get into PPE. Now, in a chiropractic and a physical therapist office, I think you are very different than from, for example, in a hospital setting where you're dealing with having to ventilate patients potentially, where you're dealing with a lot of bodily fluids. I know in a chiropractic office, very rarely are you going to have somebody that is vomiting, for example, in your office, or at least I hope it's very frequently. So the type of PPE that you need, and by PPE, of course, on personal protection equipment, is going to be different than, for example, in a hospital emergency room. And a matter of fact, it still is difficult to get a lot of high-level PPE. The MAC, and by MAC, that's the Michigan Association of Chiropractors, the MAC actually had some members that had some access to 3D printers, and they started printing masks that with the proper filters put into them were up in the 95 percentile of protection. And they were shipping these out to hospitals and things, and we thought, hey, this is a great idea. They were actually giving them away to help in the crisis. So we helped arrange for them to get 10 more of these 3D printers. And part of the deal was, is we pay for the printers. Chiropractors in the state of Michigan can write you and ask for the equipment, and you'll send it on out to them. Now, we hope those chiropractors pay something. You don't have to, but we hope that you do, to cover costs of shipping and material, that kind of thing, because we want this to be an ongoing project. Just like anything else, if it loses too much money, it's going to come to an end. But so for a source for those who are in direct patient contact, extended patient contact, like you're treating with the patient, that is a good source for masking, and masks become very important. Face covering is required under the governor's executive orders, and that means your patients anywhere in a enclosed public setting, which would include your offices, because you are treating the public. So it's required that your patients wear face covering, and it could be one that you provide if you have a good source for that, or it could just be something else that they have made. There's out on the internet, there's all kinds of how to make face coverings out of old t-shirts and jeans. And I saw an article from I think it was the Army, might have just generally been the Department of Defense, did some testing on material, and denim, from jeans actually rated very high if you have a couple layers making a mask in terms of being an effective barrier. If you have patients that object to that, feel free to use the governor as an excuse. You know, it's force of law. We have to do this. I would also point out to them that the purpose of the mask is not so much to protect you, the person wearing it. It's to protect the people that are around them. So they may feel like they're willing to take the risk of getting sick, but that's not the purpose of generally wearing a face covering like that. That is so if you do cough, you do sneeze, your normal respiratory things that everybody puts out, that barrier helps keep it from spreading throughout the community. One of the things that we've run into, gotten a lot of questions on, is about employees as people start getting called back to work. Without a doubt, even under the sustain and protect life, we're seeing a higher and higher demand by patients in order to get treated. As I had mentioned, things that could easily be put off 8-10 weeks ago no longer can be. So we're seeing more and more offices trying to call people back. Also, there is the PPP program, the Payroll Protection Program, that is basically potentially giving a grant to small businesses to keep people on their payroll. At the same time, Congress has created a program for people who are on unemployment to get an additional $600 a week. Well, for many people, that means that they may be making more money on unemployment than they will if you're calling them back to work, and that creates a conflict. We've gotten a lot of questions about resistance from staff members being called back to work. There's a few things that you can do. Number one, recognize you have an obligation to keep them safe too. And just like you have an obligation to your patients, and doing all the things that we just talked about, I think is excellent PR to your patients. Before this call got rolling, we were talking a little bit about it's going to take a while for people to feel comfortable getting out amongst other people again. You want your healthcare facility, be it a physical therapist clinic, a chiropractic clinic, you want people to feel safe going there and allowing them to see you doing cleaning of an adjusting table between patients, cleaning your hands properly, having these procedures in place. It shows that you care about their health. You want to do the same way for your staff so that they feel safe coming back to the office. This conflict between programs is really unfortunate, but the sad truth is once you make an offer back to your patient, to your staff to return to work, they're no longer eligible for unemployment. So that's one of the things that you want to do. If you have somebody that is resistant, you probably want to send that to them in writing, the offer to come back to work. And I would send it to them certified mail so that they know for sure that, or you know for sure that they have received that call back to work. The state of Michigan does have a tool called WorkShare, which might be very helpful for both your employees and your, what I just held up here, you probably can't see that very well, is a brochure from the state I printed off on WorkShare. And basically what it does is allow your patients, or excuse me, your staff to come back part-time, stay partially on unemployment, partially paid through the office, which helps in terms of qualifying your PPP loan if you've got that into forgiveness, And as long as they are receiving any money from unemployment, they're still eligible for that $600. So it can become a win-win-win. The state gets a reduced unemployment charge. You as an employer get valuable employees back to work, and the employee is happy because going back to work is not costing them more money. That is what I've prepared to talk about so far, but I am more than willing to take any kind of questions, comments. I hope you have lots of questions or comments. It's kind of weird to try to do a roundtable this way, but I welcome any kind of comments or observations.
Yeah, we did have a few questions come in, and a few of them are things that you've already touched on, such as what if an employee is making more, doesn't want to come back to work. But the follow-up question to that is, so let's say you do tell your employee they need to come back to work, but what if they reply with, I don't feel safe, or I'm compromised, or I don't have childcare? Would they still then be allowed to not come back to work and collect unemployment?
It depends on what they're telling you, whether they'd be able to come back or not. And I feel like I have a sneeze coming on, so I might suddenly go off camera here for a second. But if it's just because they don't feel safe, that is not a reason not to come back to work. You as an employer should do what you can, of course, within reason, to make them feel safe. But that is not an official reason. If they are, of course, under FMLA, if they're pregnant or just gave birth, or under extended FMLA, if they're caring for somebody who's been officially diagnosed with COVID-19, or they themselves have COVID-19, then they are allowed to go under the Family Leave Medical Act, FMLA, which actually would be putting them back onto your payroll, even though they're not there working. Daycare, I don't believe that is going to be an excuse, because they work in the healthcare industry. And because of the need for healthcare workers in a healthcare crisis, they are exempt from being able to use that as an excuse. Just like healthcare, childcare facilities, if they are caring for children of healthcare workers, are allowed to stay open. There's some actually very defined reasons why somebody can refuse to come back to work and still able to collect unemployment or go on to FMLA. If there's any that I'm forgetting out there, if you go to the MAC website, CairoMI.com, and if you go to our COVID-19 page, we have a circulating kind of headlines. COVID will circle through. Click on that. It'll take you to our COVID-19 toolkit. We also have a section for doctors as employers, and then the employees. And you can find some of these answers out there, some of the links to the official documents for this.
Perfect. What are some of the new sanitary requirements that will be put in place that now need to be followed as just a new rule moving forward? It's not necessarily a recommendation, but something that would be required.
You need to follow the EPA sanitation guidelines. So things like if you're using, I think it's isopropyl alcohol, it needs to be at least 60%. If you're using ethyl-based alcohol hand sanitizer, it needs to be at least 70%. EPA has guidelines out there for different surface types, different cleaners, how long a cleaner has to be on a surface to sanitize it. Some things are just absolute common sense, though, also cleaning an adjustment table between patients. um, every day, because the MAC staff, of course, is working at home just like everybody else. We have Zoom calls, staff meetings every day, and we were just speaking about somebody who had gone to one of their healthcare providers, and they had them sign in with a pen, and everybody was using the same pen. Well, if you're going to do something like that, have wipes there to wipe down the pen. It made a very bad impression. So those kinds of things are common sense.
I think I definitely agree with that comment, Carl. I know a friend of mine just went to the doctor and they had pens out, and they said, when you're done using it, leave it on the table as a sign that it needs to be sanitized. So I think that's a really, really great tip, and something so simple most people probably would not think of.
It could go as far as actually being a good PR opportunity. It's not that expensive to have pens printed up. Here's one from the Marriott that we had a seminar at one time. And now I'm using their pen, and I look at it and I get advertised for the Marriott every time I use it. If you wanted to, you can buy 1,000 pens fairly cheaply, have your clinic's name on there with your phone number, and have the patient take it. You know, here's a clean pen, take it with you. I've seen where they have a box of clean pens and a box to put your new pens in. Or the used pens in, and again, those are indication that those need to be sanitized.
It's definitely a great recommendation. I definitely agree with you there. We did get a few questions around masks, so I kind of want to group these together here. Your employees, are they required to wear masks? And what if one of your employees says, for medical reasons, I cannot wear one?
Okay, so part of the governor's executive order says you have to wear a mask when you're in an enclosed public space unless there's a medical reason not to. So if they have a legitimate medical reason why they don't, they have, I don't know, severe COPD, and covering the mask cuts down their oxygen load that endangers their health, then no, they don't have to wear one. However, somebody in that kind of healthcare situation, as part of protecting them, you're probably going to want to isolate them as much as possible with proper social distancing, not have them as the person that's greeting the public coming in. It says you have to, as an employer, provide them with masks. It doesn't say they have to wear them. I think that becomes part of your procedures. So I'll use the MAC. Our central office is in Lansing. It's an old house. Everybody has their own office. So we can go in behind walls. We're not in contact with each other, generally speaking. So we can isolate within the office. I would say that it would be wise for us to be wearing masks if we're going to common areas, if we're having a staff meeting where we're together in a room, where we're going and using the printer or making a copy of something, or getting a mailing ready to go out, things that are in a common area. Yeah, it's wise to use a mask. Again, not only to protect yourself, but to protect those around you. One of the insidious things about this virus seems to be is that it can be transmitted when you are asymptomatic. And again, if you're been called back to work, having to go back in quarantine for 14 days or get sick is not something that I would think anybody would want to look forward to.
Definitely. Yeah. And kind of touching on those, the areas that you just said, the common places. I know something that Traverse Connect is doing is we put red tape, we put red little stickers on highly touched areas, such as the coffee pot or the water fountain or the sink. So that could be another great idea too for people to protect their employees for highly touched areas, to make sure they're washing their hands well if they are going to touch one of those areas.
That's, and I'd mentioned having the procedure manual, and the MAC is actually preparing that for the central office when we go back to work again, when we all can be in one place, because without a doubt, decentralizing has some challenges in terms of communications with each other. And in there, we're going through and listing high use areas and noting them as a place that has to have higher levels of sanitation. For example, I can be responsible for sanitizing my office. But I think we may end up actually having some kind of schedule in the office for copiers, printers, light switches in common areas. Those things that get touched a lot, how often are they going to be cleaned, by what method, and actually have it into our procedure manual. And I would urge you to have those in your clinic also. You know, procedures are great in a manual, but if they are not living, breathing, used things, they really have no meaning.
Definitely, that's a great point. Another question with masks, when you did kind of touch on this earlier, because it is a public place, you did say that the employer is required to at least offer employees a mask. Does that go the same for customers that are coming in? Let's say they come in, they don't have one. Are you able to offer them a mask? Are you required to? What are the guidelines around that?
The requirements for them to be masked are actually on them, the way I read it. However, you can make it it's one of the costs of entering into our clinic is that you're going to have some kind of face covering. It could be your homemade one. It could be one that we provide to you if you find a good supplier. We just got in a bunch of these little masks from Amazon. My wife ordered up because we mask up when we go to a store or something. So there's those kinds of what would be considered non-medical masks are, I believe, readily available out there, semi-readily available out there. So you could potentially have them available for a patient that didn't have one. Letting them know as they make appointments to come on in that they're going to need a face covering, I think would eliminate a lot of arguments when the patient gets there. It's just like letting a patient know what the charge is before the service is performed. They don't have an excuse for arguing with you not to pay after the service has been performed. Let them know that they need to wear a mask or some kind of face covering. You know, an old scarf can be a face covering, probably not a very good one. Most of those tend to be loose, but it's something. And everything helps.
Definitely, great recommendations. And also, I have started to see people advertising that you can buy masks with your logo on it as well. So if that was a route you decided to go, was providing your own, that's something that I'm sure people could look into as well. You know, good marketing right there for you.
Yes.
So it looks like we have just one more question, and it's around employees and bringing them back to work safely. Are there guidelines for testing temperatures of employees? If so, do these need to be recorded? I've kind of heard now that you're not supposed to put their name, give them a number. Then I've heard that's not true. So can you provide some insight on that?
Yeah, since we're talking to healthcare providers here, I assume you're all very familiar with HIPAA. And I would treat information, and it is something I didn't mention, but you should do every day. There should be a questionnaire, even a taking of temperatures. Now, really taking of temperature means that you're going to need to get a touchless thermometer in. Otherwise, you're going to need to have a separate thermometer for every patient if you're going to check patients' temperatures as they come in, which actually is a good idea. Or every staff member's temperature every day. And that could get really ridiculous. So I don't know how readily available the touchless thermometers are anymore. I hope over time they become much, much more readily available. But if you're doing that, then yes, you need to protect that information. I would treat it just like a patient file. Only maybe more so. In small offices, most employees have access to patient files. It's just not practical, nor is it in terms of job sharing reasonable to exclude some employees from having access to patient files. Since these are both patient files and staff files, you may want to segregate them off where not everybody has access to it.
Definitely. No, that's really good to know. Like, that's been a common question we've been getting as well. So it's great to hear your advice on that. I did just want to know in the chat box, I did include Travelers Connect has a resource page for safety and prevention measures, all the PPE that you can find in Northern Michigan. So if you're having any difficulties, please look there. In addition to that, Carl has put together a one-pager of really great resources and links that I will be emailing out to you all today as well, so you can reference those. And on that note, Carl, I really just want to thank you so much for your time and expertise today. I'm sure this was extremely beneficial and helpful to everyone who attended, and we just really greatly appreciate it.
Well, I thank you very much.
Well, on that note, I hope everyone has a wonderful weekend. I hope everyone stays safe, stay healthy, and enjoy the rest of your day. Thanks, everyone.
Thank you.